Welcome back, beautiful tri-state area. You're listening to A Moment of Xen right here on 710 WOR, the voice of New York, iHeart Radio. I'm your host, Xen Sams. Up in just a few minutes in our Going Deep segment brought to you by CO2 Lift, we're featuring Dr. Michael Somenek. He's a facial plastic surgeon focusing on rhinoplasty, and Dr. Troy Pittman. He's an aesthetic breast expert and reconstructive plastic surgeon. Dr. Somenek is double board certified, specializing in revision rhinoplasty surgery, and is one of the nation's top experts in deep plane facelifts. Dr. Troy Pittman is board certified by the American Board of Plastic Surgery, and he's an award winning surgeon internationally recognized. He has specialized training and expertise in aesthetic surgery of the breast, including complex revision breast surgeries. They have practices both in Washington, D.C. and New York City. They join me today to chat why New York City has become the plastic surgery hub, what carboxytherapy means for your skin, and top trending surgical and non surgical procedures for 2024. Welcome to the show, superstars.
Hi there.
Thank you for having us, Zen.
So excited to chat with you. Okay, so let's dive right in. Recent advancements in deep plane facelifts include focusing on deeper tissue layers for more natural, youthful repositioning and longevity. Now, this technique minimizes visible scarring and reduces risks like nerve damage. Dr. Somenek, as an expert in deep plane facelifts and revision rhinoplasty, what are the key advancements in these procedures that have emerged recently?
Well, I think over the past 5 to 10 years, specifically with deep plane facelifts, we've really gained a more extensive understanding of what it means and the kind of results that we can get with it. And what we've seen over time is that it really increases not only the longevity, but the naturalness of the lift. Because what you're doing is you're essentially releasing a lot of those tissues that have fallen as a result of gravity. And as you release those tissues and you resuspend them back up in a more neutral position, it recreates that natural volume that we all had with youth. And so what we're seeing is not only the more natural looking scars and incisions that we have with this, but a much longer lasting result that's just very natural and refreshed looking.
I couldn't agree more. And without a doubt, New York City is becoming a hub for plastic surgery once again. Everyone is flocking back here to find experts like yourselves. What unique factors about New York City contribute to this trend, and why have you decided to focus your practice on New York City for 2024?
Well, we have a lot of patients that have been coming to DC for years from New York City and have colleagues in New York that we work with. And we're sending patients to DC. And as we grew a New York patient population and they wanted to refer friends, there was kind of this roadblock because not everyone wants to get on the train or get in a car and come down to DC for surgery. And so we had all of these patients that were seeking our services that really were in New York and didn't want to come to DC. So we thought, what better way than to bring the practice and the brand to New York to be able to serve those patients?
Without a doubt. I mean, the city's status as a center of American culture and technology and innovation extends to the plastic surgery field, without a doubt, where patients have access to a wide range of specialized procedures and specialists like yourself. And additionally, many practices in New York City, they cater to out-of-town patients, offering services that help with travel and accommodations and post-operative care, making it a very convenient choice for those seeking high-quality cosmetic surgery. So definitely New York City, bring it back to basics. Now, Dr. Pittman, with your specialization in aesthetic surgery of the breast and the body, what are the most significant changes you've seen in patient preferences and techniques over the past few years?
Well, it's such an interesting question because I always say that plastic surgery trends really follow fashion trends. And so when you think of the dynasty look of the 80s, big shoulder pads, big hair, people wanted to really look enhanced. There were the little sloped rhinoplasties, the very thin noses with the ski slopes, and that was really the look that followed the fashion trends. We went through the early 2000s where the fitted tight clothing was in. And so Brazilian butt lifts, the big butts, the very tiny waist, that was really a trend. As we're getting into this new decade, certainly post COVID, there's much more of a holistic or a natural desire of patients. Fashion is a little bit more understated. We're getting back into kind of flowy, baggy clothing. And so for body, patients are wanting to be contoured, but they want to be more slim looking. They want smaller breast implants. They want more natural facial work. And so that's really following these cultural trends.
You're so right. And when you look at overall, I think women in general, they're always going to look at, incision location. That's trending well. Implant placement right now, there's a big trend on, going back to the basics, whether it's submuscular or subglandular. And a lot of the Google searches are the type of implants because now we've seen a huge rise in BII, breast implant illness. And a lot of women are saying, I just want to be all natural. I just don't want anything in, while others are opting for something that's safer. So we've seen a lot of these trends over and over again. Bringing me to my next question, something non-invasive, something that we can all agree on. Interestingly enough, the number one skincare trend in Google search 2023 for Q3 was carboxytherapy. So people are Googling like, what is that? So carboxytherapy, it's a treatment that's been around since 1930, though the method, of course, of delivery has improved since then with this new gel delivery system called CO2 lift. But carboxytherapy is gaining popularity as a skin treatment. Can you explain what it really is and how it benefits the skin?
CO2 lift is so revolutionary because when we looked at carboxytherapy, even 5 years ago, we needed to use a needle to inject carbon dioxide into the skin. Being able to topically treat the skin is wonderful. So the way that carboxytherapy works is when the skin sees carbon dioxide, our body sees carbon dioxide as almost an oxygen starvation chemical. And so the natural body's reaction is to cause dilation of blood vessels, to increase blood flow and increase oxygenation to the skin. And so, what we need to heal when we're talking about facial contour, facial healing, is oxygen. And so, using the carboxytherapy to bring oxygen into the facial skin is really the key to healing and hydration of the skin.
And there's a really strong anti-inflammatory component to it as well. I use it for all my facelift patients, and everyone that I do laser resurfacing on, they get a CO2 lift on their skin immediately after. Because what that's doing is it's driving the oxygenation, it's driving the growth factors and the anti-inflammatory components into the skin to really expedite recovery. And that's what we're looking to do with all the treatments that we're looking to incorporate in our patients.
Without a doubt, there's a science there. I mean, the CO2 Lift Pro,
Sure.
I tried it, and in particular, CO2 Lift Pro, that's the strongest version of carboxy gel. And it's really simple. If those listening out there are trying to understand what we're talking about here, conceptually visualize, it's an in-office or an at-home treatment that delivers CO2 cutaneously over 35 minutes to an hour, and it's transdermal. It's non-invasive. It's a facial mask, and it's recommended for post-procedure care after invasive procedures such as needling, laser. Now we're even talking about medical, surgery. So yeah, definite fan of it. Now let's segue into looking at this current year, 2024. All right. So what are the top, and you could take a shot at this one, top trending surgical and non-surgical procedures and what makes them stand out?
I think this year has been particularly popular in terms of the non-surgical market, with collagen stimulation. We're seeing all different types of collagen stimulators out there. We have Sculptra, we have hyperdilute radiesse that we're injecting within the skin, because what we're doing is we're looking to really thicken that dermis. We're looking to tell the skin, hey, you need to stimulate collagen. And that truly is the anti-aging component that we're looking to restore. And so, we're kind of shifting gears a little from the hyaluronic fillers. They're always going to have a place in the market, but we're looking to complement them, if not replace a little bit of them, with collagen stimulation. So I definitely see that as a really trending thing going into 2024.
Yeah, and
Yeah.
I think for the body, we look at 2022, 2023, the number one surgical procedure has been liposuction. Everybody got chubby during COVID. And so we're doing more liposuction than ever. I think it still remains the number one treatment For me, it's one of the number one things that patients are coming in asking for. But beyond surgical liposuction, we have real advances in non-invasive body contouring. So we have devices that can actually, in a minimally invasive way in the office with no downtime, help melt fat, help build muscle. And I think that those trends are going to continue through the whole year in 2024.
I couldn't agree more. So Dr. Somenek, in the context of complex revision surgeries, how do you approach cases that have had less than desirable outcomes from previous surgeries, if you will?
Yeah,
Not so much botched, but
no, I get what you're saying. I mean, it's a very popular thing that I see in the office. It's frequent. And I think there's two components here. One is with revision surgery, you have to remember that this person may be on their second, third, sometimes fourth or fifth surgery on a given body part. And with that in mind, there's been maybe two, three, or four surgeons that have operated on that given body part. That adds an element of complexity because the anatomy may be altered. There may be extensive scarring. There's many other factors that you have to put in perspective. And I think the other component is the emotional component. These patients that are getting revision surgery tend to be very emotional about it, understandably so, because they've been through several procedures, many of them, hoping to get the result that they want and have only gotten suboptimal outcomes. And so I spend a lot of time with them, really trying to explore their motivations and trying to get them a reasonable result or expectation for their result.
so now you're a psychologist as well because you must
Yes,
take on the weight of the world when they're in your office going, "I don't like the way I look."
totally.
But yeah, no, I can imagine. It's a lot of pressure. Dr. Pittman, could you discuss the latest techniques in breast surgery, especially in revision breast surgery, since we're talking about revision surgeries here, that are setting new standards in the field?
Yeah, I think that one of the things that we are seeing uh, as really a revolution is a surgical mesh that is used now. We were using meshes in the past, but those ended up being permanent meshes and they had problems. Now we have resorbable meshes that we use as soft tissue scaffolding. So in revision surgery, whether it's to support an implant, whether it's to support breast tissue, we're using these synthetic meshes that really act as a scaffold. So just like a scaffolding supports a building, when the building is complete and the concrete is dried, the scaffolding comes down. And so with these surgical scaffolds, our body resorbs that or melts that scaffolding so it's not around all the time. The other thing that we're really seeing is an improvement in implant technology. We've moved on to the fifth generation silicone implant. Those implants are like a gummy bear. So if you cut that implant in half, it's like you bit a gummy bear in half and turned it on its side. That results in lower rupture rates. It results in lower rates of capsular contracture or scar tissue that forms around the implant. And the other thing we're seeing with this new implant technology is we're able to use a smaller implant to give the same amount of fullness and roundness to the breast. We used to be using these large implants to do that, and large implants sometimes just don't hold up over time. So a smaller implant supporting that implant with the synthetic soft tissue scaffold, that's going to really give us longevity with our revisions and our reconstructions.
That's great. For a part of me thought you were gonna say fat grafting because that's also, very popular and trending now. Women are looking at that, but what if you don't have any fat to give or
Which
you
is
don't have it
oftentimes a
in.
problem.
Yeah, because most women that are coming in to do reconstructive surgery are very, very conscious of their body, and so probably their BMI index is pretty low for you to go in and
Mhm.
extract that much fat to reconstruct the breast. Now, what are the most common misconceptions about facial and body plastic surgery? So we're talking about misconceptions that you both encounter, and how do you address them?
I think the number one for me as someone who only works on the face, almost universally, the patient will say, I just want to look like myself because they've either seen celebrities or friends in their social circles that, for better or worse, have gotten a little bit of a distorted look, whether it's non surgical, surgical, and they have a real high concern. And I do think it's reasonably or rightfully so because they have seen people like that. So I try and spend a lot of time explaining as long as you go to a facial plastic surgeon that really respects proportions, respects your anatomy, and understands your motivations, you should really come out of whatever procedure you're going into looking refreshed, like you took a week-long vacation and you look fabulous. And that really is the goal of what we're trying to achieve here.
Love it. Well, we are officially out of time. Didn't know if you wanted to add anything else or take away, but if you have some closing thoughts, I would love to hear them.
Do you have anything to add?
Well, I mean, I think that plastic surgery is not going anywhere. We're seeing kind of a revolution in younger patients getting injectables, patients coming in asking for more subtle changes. And it's just, it's a really exciting time to do what we do.
Well, you guys do what you do incredibly well, and you do it together, and that's what I love about you. You are a dynamic duo without a doubt, and I love that popular moniker there. It's a great DC dynamic duo. I love that you got. I guess that there's a .com out there waiting to be bought,
Right.
but. Thank you so much for your time. You guys were incredible, so much fun, full of knowledge, and just a pleasure to chat with.
Thank you, Zen.
Thanks, Ed.
That was our Going Deep segment brought to you by CO2 Lift. That was the awesome Dr. Michael Somenek, and that was the incredible Dr. Troy Pittman. They're practicing in Washington, D.C. and both New York City. You could head directly to their website at SomenekPittmanMD.com or check them out on social, on the gram at Somenek MD and at Dr. Troy Pittman. You're listening to A Moment of Xen right here on 710 WOR, the voice of New York, iHeart Radio. Head to CO2Lift.com for all your skin rejuvenation needs. We'll be right back after this.
A Moment of Xen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase in luminosity, and improve pigmentation, sagging, skin tone, and radiance. For more information or to order CO2 Lift, go to CO2Lift.com.